There's a lot more to come from this. In England, you can buy A2 milk. Just go to the supermarket, to Morrison's, Sainsbury's, and they have it there, A2 milk. They're not allowed to make any claims for it, but we're going to do a study on children at school with ADHD and autism, that sort of thing. You can it's not a drug trial, it's a trial between two different sorts of milk, and we'll monitor the urine, the blood, behaviour, all blind, and we see if it does make a difference there. So that's the first thing we do. Then gluten. Now gluten, you have to at least 3 months to remove that from the diet. It often produces side effects. If you've been on morphine all your life and somebody takes it away, it's not funny. So we separate the two things to make it easier for people. We published a big trial about 4 years ago now, 80 children. It's the best trial ever been done on autism as far as I'm concerned. Very difficult to try, and yes, we got a hit. Didn't cure people, we're not talking about healing, curing, recovering. We're saying it ameliorated some of the symptoms, which it did, and we had the evidence double with blinded trials, and the assessors didn't know which child was on it, and we still don't know, having done the chemistry part of it. But it does. A couple of years ago, they produced the NICE guidelines on what you can use. If the NICE people approve it, it's got to be supplied on the National Health Service free of charge. If not, then it can't be. And they said, do not use the following interventions for the management of core features of autism in children and young people. And it included diets, but it also included drugs. Do not use these, which is always missed out. When we get the comments in the newspapers, they just do that. And you forget that it says exactly the same thing about every other intervention. But notice the core features of autism. We never claimed it did help the core features of autism, but it does help certain things. And they said there was evidence that it worked, but on the basis of this, the committee decided there was insufficient evidence of safety and efficacy of exclusion like that. Further randomised placebo-controlled trial will be required. Otherwise, they want more testing done. It came out far better than virtually any other intervention. They did say, look, this isn't proof, we need more evidence of it. So we're trying to do that. Before you before you can treat the core symptoms, it says also you may be given it for other than the core symptoms, and we suggest it for sleep patterns, for the aggression, for hyperactivity, things which are not the core symptoms of autism but can be wildly troubling people. So you may also be offered special diet to help with problems other than autism, which is what we're talking about there. So it's okay, that is. So we're rather pleased with that. But they're saying we still want more trials to be performed. So now we've got rid of the main bullets, as it were, the gluten and casein. There are other things we can do. So we say keep a food diary, because very often with individual children or adults, there are different foods which affect them. Idiosyncratic effects, some with corn, some eggs, some beef. I knew 2 children who had epileptic seizures every time they ate beef. One man, avocado, drove him crazy. So we say keep a food diary and notice what happens when you eat anything. And parents are very good at spotting something else. If you notice they don't sleep at night having eaten something, then be suspicious about that, try that. If you want to test vitamins and minerals, do it now, because many of the allergies disappear once gluten and casein. For example, we had people who were allergic to apples, had real problem with apples, but once you took the milk away, that allergy had disappeared. So there's no point in testing it at the beginning before you remove these things which cause problems in the intestines themselves. What it probably does is it's not celiac disease, which is affecting the guts. There's another disorder called non-celiac gluten sensitivity, which 5 years ago was not accepted at all, but now there's evidence there. And so many of our children have non-celiac gluten sensitivity. It's not the same as celiac, it's not as violent as that, but there's a problem with it. And it does make the guts absorb things that shouldn't be absorbed, and they don't absorb things that should be absorbed. So if you're going to do testing, do it at this point. And consider worms and yeasts and protozoa as well at that point. There's a lot of other things we can address which is beyond the scope of this presentation. It's all on the internet and you can look at it, and many other things we can use which people are using, but I'm not going to talk about now. Things which we can use, I'd go on forever if I went here, but lots of other things you can use which make sense. I want to talk briefly about bacteria in the guts because it's suddenly become very sexy. For years, any physician or parent who said they think the bacteria in their intestines are wrong was laughed out of court, and the doctors would get in trouble for treating them.